Hello, my name is Dr. Piyanat Priyanun, an interventional cardiologist from Perfect Heart Institute here in Bangkok, Thailand. I have Dr. Roberto Botelho with me today. Welcome, Dr. Botelho, to Bangkok. It is the first time here.
Thank you, Biana. My pleasure to be here. It's my first visit to Thailand. I'm really enchanted about this country, and wonderful country, and more than that, wonderful people. They are very polite, and the kindness of the people really touch the Latin America heart.
Thank you so much. And Dr. Mehta, actually, he stated that you are the world expert of telemedicine, and I learned that you are president of the International Telemedical System. How can telemedicine be applied for a STEMI network, especially in Asian countries?
Telemedicine is bringing a paradigm shift in our medical practice all over. We are changing the medical practice by many ways. I would highlight that number one, we decentralized complexity, we universalize access, we provide equity, we save costs, and we improve quality. It's the first time, it's the first experience ever that we increment a new technology in medicine and we reduce cost, because we are familiar to bring new technology like nuclear resonance, like CT, digital angiograms, and increase the cost. By using telemedicine, we do the opposite by means of two approaches. One, scalability. We can scale knowledge, we can scale physicians, and capillarity. By means of capillarity, we can reach the most remote sites ever. In Latin America, we offer telemedicine for Indian tribes. And by means of these two approaches, scalability and capillarity, by applying the new revolutionary technology after the browser, we brought the historical transformation. What is the historical transformation? The speed of a new concept is increasing every day. Every 2 years, the information of the world double. By using this browser-based technology, we can accelerate information and we can share this information to the world. And then coming to Asia, coming to Bangkok and to Thailand, the more difference in the economic distribution of wealth, the more we increment the telemedicine benefits. I can give you two great examples. The Interheart study demonstrated that the lower the income per capita and the lower the educational level, the higher the level of STEMI. Then it made it clear that the high-risk population was the poor people. On the other hand, where they live, we have the lower number of hospital beds, the lower number of physicians. So those who have the higher incidence of STEMI are provided with the lower number of facilities, of infrastructure. This is the economic paradox. By means of telemedicine, we can approach them, and we can dramatically change the figures of STEMI. As we are talking about STEMI, this is a STEMI meeting. In Puerto Rico, Dr. Samir Mehta could reduce mortality from 18 to 4% and save $100 million per year. Here in Thailand, we can approach. What we used to say is that we take the hospital to the patient. Because where the patients suffer the STEMI, the heart attack, they don't suffer the heart attack at the hospital, but at home, in the airplanes, in the stadiums, in their current life. If we bring the technology, the physicians, to the place where they have the heart attack, we can detect. And by detecting, we can act and save time. And time is muscle. And we've learned from the different clinical trials that the average delay from symptom to treatment, the average delay from symptom to hospital is 2 hours in the US. And now the average door-to-balloon time is 60 minutes. Then we have a lot to improve before hospital. And 70% of STEMI mortality will happen before hospital. By this very short information, I summarize how can we benefit Thailand, how can we benefit Bangkok and all the Asian population by universalization of access to diagnosis and decentralization of complexity. You as an interventional cardiologist can help remote sites with your knowledge by means of technology.
And how do you foresee the future role of telemedicine?
I used to compare to the mobile phones. When the first mobile phones was launched, people predicted that it should be restricted to very rich people. In my country, there are 200 million people. There are 250 million mobile phones. The same we witnessed with the computers. In the beginning, they predicted that there would be not more than 100 computers in the world. Since 1995, more computers are sold as compared to television sets. Then, how we predict the future? The technology is there. It will come. And it will be implemented in all health systems in the world very fast, very fast.
Thank you so much, Dr. Botelho, for joining us today.
Thank you, my pleasure.